While HIV is decreasing among most groups, it is on the rise among Navajo and other Native American groups. Paulino Armenta says taboos are very strong among Native Americans when it comes to talking about HIV and AIDS.
When the subject of HIV/AIDS and the Native community is brought up, I think about stigmas within our Native community. Just the subject itself of HIV and AIDS, but along with that, another stigma or a topic that people don't want to touch is about sexuality and about sex itself.
Dr. Paul Bloomquist says the Navajo reported as many as 40 new cases of HIV last year, roughly 4 times the number reported in past years. Much of that is due to better testing. His group is also working with Native American communities to encourage them to get treatment, often by incorporating traditional ceremonies and herbal treatments.
The other thing we have here at the Phoenix Indian Medical Center is a PhD level pharmacist who really knows herbal remedies and can help people decide which things might be harmful if used in combination with Western medicine.
Trudie Jackson says the Navajos struggle the most with dealing with HIV and AIDS because many in the culture don't understand the disease and they don't trust outsiders.
One of the things that I have learned working in the field is that Native Americans feel more comfortable talking about prevention and education with another Native American.
Ron Porter says Native Americans contract HIV in many ways, including drug use and unprotected sex. He counsels people on prevention skills.
Just because of the bar I was going to, the people that I was having sex with, in this case, I knew nothing about intravenous drug use. People were shooting speed. I didn't know that. I'd never see it. You think of someone shooting speed like, doing heroin. That's your picture. These are healthy men, manly men, dressed in leather and stuff, that beards and whatever. And it just never dawned on me that they ended up shooting up. And like that bar, probably they had closed because most of its clientele died. But that's probably how I got infected.
Officials say the best way to combat the spread of HIV and AIDS among Native groups is to educate them about the risks of the disease and encourage them to get tested. Many people don't even know they are infected.
If I had never got tested, I wouldn't even know I had it.
Raphael James is proof that the Navajo are listening to counselors. He visited a mobile HIV testing clinic recently because his wife is sick with an unknown illness. He heard about HIV and thought it would be good to get tested.
Actually, to be honest, I was at first, but now with the way my wife's health is going, with all the daughters and sons that I have, you don't know what's out there these days.
Get tested. 1 in 5 people don't know they have HIV infection. And the only way that they can prevent transmission to others and to get well or prevent themselves from getting sick is to get tested and know their status.